My view of leadership and what it means to be a leader has definitely evolved a lot after being part of ASF. I came into this fellowship knowing what kind of leader I wanted to be, and to me, the perfect image of a leader is one that can create a supportive environment to empower others and to guide others. While I still believe this is important, I've come to realize that leadership and being a good leader isn't always perfect, and that sometimes you have to be vulnerable and be comfortable in your vulnerability. You have to be open to feedback, both positive and negative, and to never give up and to show resilience when faced with difficult challenges.
My time with ASF has further emphasized what this means to be a leader and how you can go in, with a set plan, thinking this is what I'm going to do to help this population, this is how I'm going to serve. However, that's not the reality of it, and that's not being what I think, true leader. True leader goes in and asks, how can I help? What can I do to serve? And then is okay with pivoting throughout the project and figuring out, what is working, what isn't, and constantly asking for feedback.
Initially, I believed that a leader is an individual that is typically assertive and extroverted and serves as the sole decision maker. However, my perspective on what it means to be a leader has drastically changed after completing my fellowship project. While I do believe that leaders should be assertive, I also believe that leaders can also be soft-spoken because ultimately, an exemplary leader should exert their leadership abilities through action and how they care for others.
I would say a big part of leadership to me through this project that I learned is bringing people together and learning how to get people to work together, whether that be our partner organizations that we were working with or the Woodlawn community itself. And what stood out to me is the Woodlawn community was searching for a degree of autonomy and independence through this project. And I think that through good leadership, it's important to be able to recognize that and know how to give that to people that you're working with in order for them to thrive to the capacity that they want to.
Before starting this project, I was a healthcare provider for my patients. Since working on this project, I've learned to redefine that role to provide care for people who don't come to the clinic. And the work in this project really affects people at an earlier stage, more at a systemic level. And I've learned to use the authority that comes with being a healthcare provider to gain support for these sorts of projects that improve the lives of people.
Looking back on what my participants taught me, they taught me to look at individuals who may be struggling beyond what they're struggling with. It's easy to take a person's situation and allow it to essentially label them, but it's important to continue to view people as people rather than their circumstances and their struggles.
During my time as an Albert Schweitzer Fellow, I've gained invaluable insights from the participants at the UAB Gender Health Clinic. Beyond listening to their lived experiences as sexual and gender minorities, I've learned the importance of embracing discomfort in order to grow. The participants have truly deepened my understanding of the barriers they face in accessing healthcare and have shown me how I, as a future healthcare professional, can create an inclusive and supportive environment for individuals from diverse backgrounds. I am committed to continuing my work with diverse communities and continuously improving my ability to provide the utmost high-quality, compassionate care for all individuals.
Through this experience, I learned the power of advocacy and adaptability and how to support those that don't always have the support that they need. As a future physician, I'll be able to use the experience that I learned to be a better advocate and provide better care for patients with disabilities.
One important thing I learned from my project participants is that people really do want to learn more about their health. They're very open to insight and resources that are shared with them, but the major obstacle for them is just that, access to those. Working with the Hispanic population in Birmingham, the biggest thing we saw was language barriers, and a lot of patients aren't able to bridge that gap themselves. So it really just takes small efforts from our side as healthcare professionals to make a big difference in these patients' lives. Small things such as changing informational paperwork into multiple different languages can really affect a patient's healthcare outcomes. And I think that's something that we should all be working toward as professionals, is to make healthcare information as accessible as possible for all of the patients that we treat.
Working with Spanish-speaking patients or members of the Latino community has made me deeply aware of the privilege I have as a future dental professional. Knowing that I can ease someone's dental anxiety or confusion by just speaking Spanish or taking a few extra minutes to explain things is something that I don't take lightly. It has made me more committed to practicing with humility, by listening first, respecting each patient's experiences, and creating a space where everyone feels valued and cared for.
One of the biggest takeaways from this project was the importance of communication. Learning how to share information in a sensitive and thoughtful way was essential to our approach. To ensure we were fully prepared, we engaged with key stakeholders and community members, equipping ourselves with the knowledge needed to navigate complex conversations. This experience also highlighted the privilege we have in medicine and the responsibility that comes with it. Cultural humility and effective communication are lifelong skills that I plan to continually develop as I move forward in my career.
As a healthcare professional, I've learned that there's power and privilege associated with being in my role. I see the gaps in social determinants of health and know that real change starts by listening to the communities affected. I've also learned never to assume someone has the same health literacy that I do. Asking questions first is key. Too often, people outside of healthcare are taken advantage of, and it's my responsibility to engage with cultural humility, ensuring that healthcare is accessible, understandable, and empowering for everyone.
In my future optometric career, I plan to ask more questions. I know people seek an optometrist mainly when they have issues with their eyes, but what other problems does that patient encounter? Do they have a safe place to sleep at night? Do they have health insurance? Do they have food security? The ASF Fellowship has taught me to serve people with a thoughtful mindset. This fellowship has allowed me to build a strong foundational knowledge regarding the community of nonprofits. I am now confident to address more complex issues to serve patients fully.
As a health professional, we have the opportunity to see a need and make a change in the community to address those needs. And it's being aware that it's not just personal circumstances, but outside circumstances that can cause the health issues that they may be dealing with, and just being able to recognize that and not have any judgment based on the circumstances that they can't control.
Our project entailed facilitating dialogues on difficult, controversial topics among teens. I was surprised by just how diverse these participants were. They brought so many different types of experiences, backgrounds, and levels of knowledge to our communal table. I was fascinated by how the same exact prompts would elicit very different types of reactions and conversations among different groups of people. As a healthcare worker, this reminds me that each individual and the family or friends who accompany them each have complex intersectional identities, and messages from the healthcare team should be thoughtful and responsive to these needs.
ASF has helped enlighten me on the vast array of health disparities that exist within our local community and state that unjustly prevent health equity in our medical systems. I plan to keep this new knowledge on these particular disparities in mind regarding the unhoused population, the incarcerated population, and racial minorities while acting as a physician in order to promote a holistic and personalized approach to their unique medical needs and social determinants of health.
My experience with Albert Schweitzer Fellowship suggests that health equity in environmental public health starts with access to information and community engagement. I have seen how air pollution disproportionately affects underserved communities and how empowering residents with knowledge and tools like Air Monitor can help them address air quality concerns.
As a mesosocial worker, I'm learning how to advocate for practices that address the social determinants of health, such as lack of housing. My project allowed me to consider how a small community group with reinforcing relationships might nurture and apply new and transformative ideas until a time when transformation might reach a critical mass, changing an institution or a society itself.
Through this process, I've gained a deeper understanding of the significant health inequities affecting Alabama residents. As a future mid-level provider, I am inspired to take intentional action to help reduce the healthcare gap. Whether it's advocating for federal funding to support rural local community health centers and initiatives like OnMed, or collaborating with organizations such as the National Health Service Corps to encourage the placement of mid-level providers in underserved areas. My goal is to be part of the solution.